Hello, and welcome to ASB TDC TV, a product of a partnership between the University of Arkansas Small Business and Technology Development Center and the Northwest Arkansas Council Small Business Emergency Assistance Program. In this series, we are talking with small businesses, experts, and ASB TDC consultants about the relevant and right now topics and solutions for business. I'm Amy Robinson.
Hi, everybody. My name is Chris Case, and we've got Rise Physical Therapy with us today, Derek and Tyler. And so, Tyler, I'm going to hand it off to you. Tell us a little bit about your business and how you've had to be creative throughout this time.
Thanks, guys. Thanks, Chris. So we've been open for 4 years. We have 2 clinics in Fayetteville. Me and Derek both live in Fayetteville. COVID definitely has kind of been ever-changing, been a long 5 months. Kind of the biggest change for us was kind of turning away patients who didn't meet certain criteria that made them need to be in the clinic to kind of make sure people were self-isolating and just kind of limiting exposure in the clinic. With that being the case, the biggest kind of pivot point was having to add telemedicine to our kind of list of services. That was something we've never done before. We'd kind of briefly mentioned the idea of it in the past, but never really researched it. Didn't have the, look into the insurance information, that kind of stuff. So basically within 2 or 3 days of like, hey, this is going to stick around for a while, we had to create like a new business basically. So we had to kind of switch business models and offer telehealth visits with Zoom calls, with different kind of platforms that work best for the patients. That's challenging for physical therapy. Sometimes it's a hands-on service. So
I was thinking exactly that. I was like, physical therapy.
Physically be there. And it's really been a challenge even for our therapists at first because we hadn't done it before to kind of figure out like, how do I change what I do on a daily basis? But luckily kind of our philosophy with treatment methods made it very possible. I just had good outcomes. I had patients that had surgeries who lived out of town and couldn't get to therapy, and they had really great outcomes. Similar outcomes they would have had in the clinic, which has been great to see. Makes us a believer of it, and it's something I think will stick around like long term for people who are stuck at home. They can't drive. They live more rural.
Right.
So those types of things I think will be. I mean, hard to say there's going to be anything positive coming out of something this but
Absolutely.
I think everybody's kind of learned to be flexible and adapt, and I think that was our biggest kind of adaptation.
Yeah, that was one of the things I was going to say, is that there are probably some benefits of that from a time and scheduling standpoint and having to navigate that. Tyler, I know that you've been around for about 4 years, and I'm curious because, in addition to all of those things that you're navigating for your patients, you're also navigating things for the business and the business model. And I know that you are a client of ASB TDC, so thank you very much. And you've had to get that information and get people covered. Is there anything from a business standpoint that, in the medical industry that you found was really pertinent, key, or that you could even throw out there as a something that you learned that you think is shareable?
That's a good question. Yeah, my job kind of switched from patient care majority of the time to survival as far as like a business model and revenue. So we had to really cut expenses where we could. We had to kind of reevaluate our budget, a line item, and see what could be cut out. Kind of a big part of my job became working with Erin Lee, Derek's spouse, in order to like what grants are out there, what loans are out there, like what's accessible to us. And your organization was super helpful in navigating that process because it was kind of a complicated process that changed every 2 seconds, basically. So
it still is.
Yeah, I was just going to say it still is.
But it became extremely helpful for a business like us, whose majority of our expenses are payroll. So like PPP was perfect for us because we don't buy things, we don't buy retail stuff, we don't buy products, we don't buy food. So it was perfect for us to allow our staff to stay on as long as we could, and to get them back quicker than we could have without it. So it was great to be able to have those things to kind of still be able to provide the service for patients who needed it, and still have our team be able to work together.
Buy you some time to adapt and make some of those care adaptations.
Right. Well, Derek, how about you? I mean, what's your spin on it? We were talking a little bit before we started recording, and you had some good information that would be helpful to be shared.
Yeah, I mean, I think coming from our original business model has always been just kind of one-on-one care, which has always reduced kind of the the number of clients or patients in our facilities at one time. And so it wasn't a huge shift from, as far as that goes, from a revenue standpoint, it wasn't like limiting the number of people in our facility as much as, like Tyler was saying, it was more limiting. Okay, we had to be more selective on choosing which patients were priority and really needed therapy first, and then which patients may have been high risk, maybe our elderly or maybe even immunocompromised patients. And so those were the big shift. I think from a revenue standpoint, I think it was kind of a good shift to be able to kind of do a deep dive into the numbers and see, okay, well, what is necessary? What are our basic functions that we have to be able to have to operate, and being able to tease those things out, and it was probably pretty valuable just from a strategic standpoint.
Yeah, that's a really good point. Well, and I think that you mentioned also that, you're in the medical profession. And so some of the precautions that you would take normally in a medical environment are continued, but it's more of an adaptation on the patient side. The forethought and some of the things that we have to do to continue that. So obviously there's some continued care, but what do you feel like what do you think is going to stay for a while when it comes to your patient and clinic precautions that you're going to be taking?
Sure. I think that kind of just our PPE, so like just personal protective equipment, that those things are probably going to stick around, would be my guess. We kind of took on, I think from a medical standpoint, we've always done cleaning and kind of cleaned up, changed any linens that we needed to between patients, wiped down surfaces, things like that. We just kind of take that up to another level. And then, of course, all our therapists are required to wear masks and gloves as we are in physical contact with patients. And so it's almost as if we took kind of a bigger step towards almost surgical precautions with physical therapy. And so I think those things are kind of probably here to stay as we see benefits of those things. I think what we'll see is, I know everyone's kind of focused on COVID numbers, but I would guess that with all of this, other infection rates probably go down too. Like even flu, other things will probably reduce as everyone is extra cautious. And so I wouldn't be surprised if those types of things encourage the medical community as a whole to adopt those practices. The biggest shift is probably for our patients, the inconveniences on their side, mainly because for us, it just becomes kind of daily life, but for them, like having to exercise in a mask, if I'm having someone do kind of a higher intensity exercise with a mask on, or if I have a runner, for example, that I'm treating, and I have to have them run on a treadmill for a gait assessment, that gets a little taxing if they're forced to wear a mask indoors and do that. And so, yeah, it's definitely interesting. But I think our clientele are more willing to bend to those regulations, just by means of being a medical facility. We kind of have perhaps that luxury that maybe our restaurants don't get. And so our customers going to a restaurant may feel like they should have the freedom to take their mask off more than just while they're eating, or they may forget to put that back on. In our facilities, I think there's probably a little bit more of like a social pressure to abide by those rules.
Being a medical.
Well, you guys, you started the first location on the east side, and then just recently opened up, not too recently, but opened up your second location. Did you see any difference with having kind of an established business and a new business, with any differences? I mean, it all falls under the same umbrella, but Was there any difference or any different hurdles that you had to take with either location?
I think it was mostly just making sure our operating standards are the same at both locations. I'm primarily at our Weddington location, and Tyler is primarily at our East Fayetteville location. And so making sure that we are in constant communication of, okay, well, what are we doing? Are we operating the same way? Are we maintaining the same standards? Because they need to be identical across the board. And so that's the main issue. Our Weddington location has been in effect operating for 2 years now. So it almost doesn't seem new anymore. But
Yeah.
Well,
I'd say the Weddington location was the slower clinic of the two during kind of the height of March, April, May, kind of that period. And that normally wouldn't have been the case. Normally we're even. Sometimes Weddington's a little bit busier. What that reason was, I don't know. We are closer to college campus there, so we treat quite a few college students there. So maybe them going home, never coming back after spring break, that could have been part of what kind of changed that. But I don't know if one clinic being more established than the other had an impact on us as a whole.
one of the things you mentioned was the medical community, and I'm just curious, who is supporting you in the medical community? Do you have, groups that you're tapping into for information? For instance, when you were trying to get up on telehealth, I would imagine that, we host forums for businesses, but what we're finding is that you all get the most benefit when you're talking to each other. So are there other businesses or support mechanisms that, maybe other people should know about that is helping support you both as a business, but as a medical facility as well?
Yeah, so I guess it wasn't a whole lot locally as much as kind of regionally throughout the state and even our national organization.
Mm-hmm.
So we're part of RehabNet, which is a group of private practice PT clinics like us. So it's a great forum to send an email out like, hey, this is what we're running into, what hurdles are y'all finding? And we had some Zoom calls as a group to kind of bounce those thoughts off of each other. And then even a simple thing like a Facebook forum, like there was physical therapy telehealth forums that popped up, and there are people asking the same questions that you're having and being able to see those things. And then colleagues you've worked with in the past. I had a PT in Memphis that had been doing telehealth for a year, so I knew that. So I was able to reach out to him and kind of get some kind of good guidelines on what programs he uses for software, and that kind of stuff was extremely helpful. We don't really have a local Northwest Arkansas kind of rehab alliance that I'm aware of, which maybe would be beneficial.
Yeah. Well, maybe we need to get one.
Right, that's our action item.
Exactly. Well, of course, we want to make sure that everybody knows where to find you. And so give us any of your social media or other contact information where people can look you up and know now that they know what to expect at your fabulous facility.
Yeah, we're on social media. We have a Facebook and Instagram account, and you can find us there. Or our website is riseptnwa.com, and you can find information on how to reach out and contact us there. And we also have some. We try to keep it updated with educational information too, just on general health and fitness, things like that. And yeah, we're in a non-COVID world. We're out in our communities a lot, and at races and different events of that sort. And so hopefully we'll be seeing everyone out there soon.
Get back to that soon. Absolutely.
One thing I would add is referrals not required for physical therapy, which is something most people don't know. So if people are curious of what we do, you have neck pain, back pain, you give us a call, go on our website, appointment request, whatever works for you, and we can usually get you seen in that day and covered with insurance.
That is amazing.
Oh, I didn't know that.
I know, I didn't either. That's fantastic. That's wonderful.
Yes.
Well, and your series of workout videos is launching soon too, right? Oh no, that's a different client. Never mind. No, I'm just kidding.
Oh, there's a new idea for you guys.
There you go. If you need a new revenue stream, there you go. Well, thank you so much for joining us. And thank you as a listener or viewer. If you have a suggested topic, a question that you need answered, or someone you'd like to hear from, or a story that you'd like to share, please contact us at bizhelp@uark.edu. That's BUSHELP at uark.edu, and put TV in the subject line. If you are interested in benefiting from our free one-on-one consulting assistance, please sign up at sbtdc.uark.edu. Thank you for joining us. And thank you all for being here.
Thank you guys.
Yeah, it's pretty good. Have a good day.
See ya.